That's a national analysis was a very nice collaboration between the Belgian Society for Medical Oncology and the Belgium Cancer Registry. So what we did, we were looking, there are several trials already, small trials that they tested whether patients with stage 4 metastatic breast cancer, if they had the surgery of the primary tumor, if they had a bad outcome or not. So the data is very inconclusive. So what we did, we took the data from the Belgian Cancer Registry from patients with the novo metastatic breast cancer, meaning stage 4 in the beginning of the disease, from the years 2010 to 2014. So we had in total 2,627 patients. What we did a landmark analysis looking for those patients who did not die in the first 9 months of their disease, meaning that all patients, if they survive 9 months, they had a similar chance of having or not having surgery. That's why we did this landmark analysis. So in this landmark analysis, we included 1,905 patients. 534 patients had surgery of the primary tumor. 1,451 had no surgery. So what we found that those patients who had surgery, they were younger, they had a better performance status, 0-1, and they were more HER2 positive disease. What we found in terms of overall survival, which is very interesting. So patients who did not have surgery, they had a median overall survival of 41.9 months. Those patients with surgery, they had a median overall survival of 60.1 months. This means a hazard ratio of 0.56, meaning that those patients, there is an association between have surgery and have a prolonged overall survival. We looked into the patients who had the best outcomes are those patients indeed with a performance status 0-1, a good performance status, with hormone receptor positive HER2 negative disease, or with HER2 positive disease. All of these patients, they had a better outcome. Patients with a low performance state of 2 to 4, that worse performance status, they had a triple negative disease, they had not so important benefits in having surgery. But for the triple negative, we have to take into account that numbers are very small here, so to draw a conclusion. So I think that what this analysis shows us in a national-based source, that if a patient is respond well to treatment after the 9 months, we may consider discussing this with the patients. Of course, this is always, we have to clearly discuss with the patients, say that we do not have a clear randomized data, but you have this data that suggests that the patients may go better. So there are some bias here, but I think still this is a very interesting data, and certainly I always discuss this possibility with my patients, because I think if you remove the primary tumor, if they have a controlled systemic disease, the patients had a better outcome. And this clinical feeling we can see in this data from the Belgian Cancer Registry.